Go on. Okay.
And we are now starting.
Okay. The first question is, what HIPAA violations, if any, occurred?
So, divulging information without asking if the patient wanted their information handed out.
Yeah.
Because they didn't even ask. I mean, like, how'd they even know she was related?
Yeah, she just said, I'm his daughter.
Yeah.
Was it his daughter?
Or
his
sister or something,
sister,
yeah. And they just started giving out information.
Like, even if they are family, you can't give out information like that unless you're like
Unless they're on like
a
their
guardian
list.
or like a conduit or something like that. Or like
Yeah.
they're in charge of the family care and they have like written consent and stuff like that.
Mm-hmm.
You're not supposed to share it with anyone unless they're on the
Caring
team.
for that person.
Yeah.
Which I know that's hard because you just, sometimes I feel like you're maybe asking for advice on a patient. So I don't know, that line gets a little bit blurred sometimes, I would think.
Yeah, I'm sure it
You know,
does.
like asking other medical personnel who aren't taking care of him, like just kind of maybe talking about him or bouncing your
to
thoughts
the
or
other
ideas.
one,
Yeah.
to somebody.
Well,
And that's
the
fine,
thing,
but as
yeah.
long as you're not giving out their
Oh,
their actual
their name.
Their
information,
name, yeah,
their
that's
name,
true.
and then all their
Because like
their
in this
results
situation,
and stuff,
he
then, yeah.
was positive for HIV, right?
Mm-hmm.
And so his sister probably didn't know that.
Oh, I
Because
didn't think of that.
I don't think he knew that either, right?
Yeah.
He just found out,
right?
yeah.
So if she wanted to get advice or whatever, she just could have said, I have a patient
Oh, mm-hmm.
that this is happening, like, what do you think? Like, just not giving any direct.
Well, I would say even if she was like a family member of this person, just had a concern and knew what was going on, you could still talk to nurses about that. But the thing is, they
Mhm.
can't give out any information on the patient themselves.
Yeah,
They can just give it as if they're like a general patient.
yeah.
Like, oh, he's got a cough. What can we do? Or what's
Mhm.
the cough like, or anything like that.
Yeah.
You can say those things, but you can't give out their actual results
Mm-hmm.
or anything that's going on.
So, what do you guys think about how they have like pod huddles and kind of go over patients? For like when you go to lunch, you're like, hey, can you watch my patients? And you tell them about them
Yeah.
They're part of the care team.
at that point, because then they're,
Because they're helping
Yeah.
take care of them.
They're
Okay.
charting. They're doing
Yeah,
things. They
that's
need to
true.
know.
okay,
That's I never thought about it like that. Like
Yeah.
the difference between collaboration and breaking
HIPAA.
HIPAA.
Yeah.
Now, if you're
That's
gossiping about somebody,
Yeah.
that's
Yeah.
definitely very HIPAA.
Yeah.
Yeah, that is true. Okay, the second question is, what about the environment in which the conversation took place made it inappropriate for sharing protected health information?
Oh, they were out in the open.
They were just at the
Yeah.
nurse's station. Everybody
Mhm.
walks by the nurse's station.
Yeah, everybody could hear them.
Yeah, or even people who were in the rooms close to
Can
those
hear.
can hear.
Yeah.
I think the door behind the nurse was open to another
Mhm.
patient room. Whether there's a patient
Yeah.
or not, but it was still open.
And yeah, I can hear, you can always hear when you're in patients' rooms, the
Which
nurses
is kind
talking
of like
and
dangerous
stuff.
because I feel like everybody shares patient information at
Mhm.
nurses' stations.
Yeah.
Mm-hmm.
It's a hard thing to avoid.
Yeah.
Yeah, because where else? Like, I guess if you're just quieter, I don't
Mm-hmm.
know, in the patient's room too. But
But all that, even when the sister came up and asked questions and the nurse started to answer, they didn't like go to the room or go somewhere private. They just stayed.
They
and
still
told
stayed on
her
it.
everything right there.
Mhm.
And the nurse, and the one nurse was behind the desk, and the other one was on the other side. So like she could have been around where it's more like, so you're not talking so loud either, I guess.
Mhm.
I guess it's different that they, like you pointed out, like they weren't in the patient's room talking to them. Because if
Mhm.
she was in the room there, she was authorized to, then they could have discussed
Yeah.
it. She would have seen what was going on.
Mhm.
Yeah.
Kind of like how Summer was saying about her
Mm-hmm.
patient today. The
there.
daughter was there, so she knew everything was going on. But that's not a breach of HIPAA either.
Mhm.
Yeah, that's true. Okay, what could happen if the family member tells the client about the nurse's conversation?
Lawsuit.
Yeah.
Right? Yeah.
Huge lawsuit.
You could get sued.
Mm-hmm.
Bad.
Yeah, because if that's something he didn't want his family to know about, because it's
Especially-
a serious
License.
thing.
Yeah, especially
Usually.
HIV because
Yeah.
they, I believe, I could be wrong, but like with HIV, they can't even tell your other partners. Like you have to be
Oh, yeah.
the
Mhm.
one who.
Like really, like us at work, we had a guy that had HIV, but it doesn't like, it's not like you have to put more protocol on or something, like, because that's shaming them.
It's
So
kind of
you
dangerous
just-
though if you're a
Yeah.
partner and you don't know.
Yeah.
what to do.
Yeah.
That's really messed up.
Yeah.
Yeah.
But at that
But you
time,
could get in
it's
trouble
that
for saying
person.
something. Yeah.
Yeah.
It's up to the person to tell their partner.
I'm pretty sure they could lose their job too.
Yeah.
Oh,
lose
yeah.
their
No
license.
license, yeah.
I would think so.
Mm-hmm.
Yeah, that is weird. What are the nurse's responsibilities if she notes a HIPAA violation?
She has to file a breach report.
Like tell on herself, like, hey, we were out in the open discussing.
Yeah.
If it gets to that bad, yeah, you probably should. There's,
I mean, it's probably better for you to be upfront about it.
Or what does that
before,
do?
But
each
I don't
company
know,
has
like save you?
HIPAA patient information tracking, and in the medical field, and they're required by law to report things that are breached like that. And so it's part of their responsibilities, and if you don't, it's a lot worse.
Do you think you could still get in just as much trouble though?
I think you'd still get in trouble, but they probably, if you're upfront about it, I'm sure they
You
would.
can like save your license, kind of.
Circumstances
honest
would be
about it.
different, yeah.
yeah, like you'd be written up, or I don't know.
Because it's better for you to do it rather than a disgruntled patient then that files a lawsuit. Because it's internal.
Because
It's
maybe
internal
you
catch.
can deal with it before it gets
And
to the
then
lawsuit.
sometimes they may not even do it or say anything, but you just have it on record that it's there.
Yeah.
Do you ever think like that maybe they didn't realize that
Yeah,
they're
because it's kind of like you're just like talking,
Having a
you know?
conversation.
Like
Yeah.
you're not even thinking about it. Like sometimes it's hard because, yeah, like I've had that situation where I have to tell the nurse something, but the nurse is like walking away from me, and I'm like, you need to stop so I can tell you what's going on, you know?
or even like when you're walking and talking,
Yeah.
you might not be sharing like, too much information, but you're never aware of who's all can
Who's
hear.
listening?
Yeah.
Yeah.
And like I've noticed sometimes in the hospital setting, like if management comes around, people will quiet down,
Uh-huh.
but family members, they don't.
Yeah.
They just keep talking.
Most PHI information HIPAA violations go undocumented and unnoticed.
Mm-hmm.
I'm sure there's a ton.
It's just
I'm
so easy
sure.
to talk about.
Yeah, I'm sure.
And you're like,
I-
and it's not even for like bad intent either.
Mm-hmm.
Like,
I feel like a lot of like nurses or whatever, if they go home and talk about their patients, they're not like saying their names or whatever. Like
Yeah.
they were probably just gonna be like, oh, I had a patient today like that. So sometimes I feel like that's not as bad, rather than when you're with a coworker who knows your patient, they know more, and then that's worse.
And the patient's there where you're talking about.
And then that's
them.
that's like actual HIPAA,
Mhm.
because they know they can like access.
Did you know it's a HIPAA violation to even look at a patient's chart that's not
Yeah.
yours?
Yeah.
Or like looking at the ED board?
Yeah.
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 I
All
think
of
it's
that,
like if
which
you're-
is silly. Like you're obviously gonna look at the board.
Looking at the ED
Yeah.
award is?
Yeah, like if you click in them, like you can
Oh.
see like initials and what they came in for, but if you like click on it to see their actual name and their age,
Mm-hmm.
then it becomes a HIPAA violation.
even if it's your own family member.
Yeah.
Yeah.
You can't look up your own.
I think you can't look up yourself. I think it's
Mhm.
also a violation.
Which that is
Which
Yeah.
is weird.
Yeah.
It's my own stuff, obviously. That is weird.
Yeah. So they should have, I think, in my opinion, just talked maybe around the corner or in
Or even the nurse going to the other side of the
table.
nurse's station,
Uh-huh.
so they're next to each other and
Not
not,
having to be
talking
so loud.
so loud.
Mhm.
Makes the difference too. Because I don't know where else you would give.
Yeah.
Because you give report. Well, we give report at the nurse's station, like the nurses do.
Mhm.
Like CNAs, we go down the hall as we're walking past the rooms. I don't know if that's any better.
Mhm. But when the family member came, they should have went to the patient's room and been like, "Hey, this person wants an update on you. Is it okay if I give them?"
Yeah.
Is it verbal?
I don't
if they say
know
yeah,
it has
that's
to
fine?
be,
I think that's
I would assume so.
Yeah.
because they're giving it the okay.
So, or do they have to like sign something
I feel like
this
you
person
sign a
can
paper
have,
every time you
access.
go somewhere.
I think you have to sign something that says this person can access my
Yeah.
medical record.
Yeah.
Yeah, I think so. I had to do that for my husband.
Anything else you guys have? I think that covers it.
Yeah.
Just we got a minute left.
For 10 minutes?
But yeah, I guess we did 10 minutes.
Okay.
So
Yeah,
we're
so
good.
we should be good.
Alright, so be good at PH.
Thanks, everyone.